Have you ever wondered why migraines, more than just simple headaches, can be so debilitating to those suffering from them? Well, to understand this, we first need to grasp what a migraine actually is. Contrary to common belief, a migraine is not just a severe headache, it's a complex neurological condition with a wide range of symptoms. The most common one, of course, is a throbbing, intense headache, usually on one side of the head. However, a migraine is more than just that. It's an intricate interplay of genetic, environmental, and neurological factors that result in an overactive brain, sensitive to triggers and prone to intense headaches. This is why it's often categorized as a chronic disorder, not just a temporary inconvenience. And this, my friends, is what makes migraines a serious health concern. Now that we understand what a migraine is, we can delve deeper into the signs and symptoms. Identifying a migraine is the first step towards managing it. So, what are the symptoms? Often the most prominent symptom of a migraine is a severe headache. This isn't just your run-of-the-mill headache, but a throbbing or pulsating pain that typically affects one side of the head. It's like a drum, incessantly beating inside your skull, relentless and unforgiving. Alongside this pounding headache, nausea often comes into play. It's a gnawing feeling in the pit of your stomach, an unease that can escalate into vomiting. It's as if your body is rebelling against itself, trying to purge something unseen. Then we come to sensitivity to light and sound. It's as if the world around you has dialed up the volume and brightness. What was once a soft murmur becomes a roar. A gentle sunrise becomes a glaring spotlight. This heightened sensitivity can make everyday surroundings feel unbearable. Finally, some people experience visual disturbances known as auras. These can manifest as seeing spots or flashing lights, almost like an unwanted light show in your field of vision. It's disorientating, confusing, a visual cacophony that precedes the storm of a migraine. Recognizing these symptoms can alert us to the onset of a migraine, but what causes these symptoms in the first place? The exact cause of migraines isn't fully understood, but there are known triggers. What are they? Let's delve into the 5 known triggers of migraines. First, stress. It's a well-known fact that stress can lead to a number of health issues, and migraines are no exception. High levels of stress can trigger these intense headaches, making stress management a vital component in migraine prevention. Next up, certain foods and drinks. Yes, what you consume can impact your likelihood of experiencing a migraine. Foods high in tyramine, such as aged cheeses and smoked fish, and drinks like alcohol, especially red wine and highly caffeinated beverages, can trigger migraines. Third, intense physical exertion. Activities that require significant physical effort, such as heavy lifting or intense workouts, can sometimes induce migraines. It's important to note that regular moderate exercise is beneficial, but overdoing it can lead to trouble. Fourth, changes in sleep patterns. Getting too much or too little sleep can trigger a migraine. Regular sleep patterns are key in preventing migraines. Lastly, hormonal changes in women. Fluctuations in estrogen, particularly during menstruation, pregnancy, and menopause, can trigger migraines in some women. Hormonal medications such as oral contraceptives or hormone replacement therapy can also be a trigger. Understanding these triggers can help in managing migraines. But what are the potential complications if migraines are left untreated? Migraines can have more serious consequences than one might think. What complications can arise from untreated migraines? Firstly, we have chronic migraines. This is when a person experiences a headache for 15 or more days in a month for at least 3 months. These prolonged periods of discomfort can significantly impact a person's quality of life. Secondly, there's status migrainosus, a severe and long-lasting type of migraine that can persist for more than 72 hours. This condition can lead to dehydration and requires medical attention. Next, persistent aura without infarction is a rare complication where the visual disturbances or aura that precedes a migraine last for a week or more, without causing a stroke. Though it doesn't lead to a stroke, this persistent aura can be quite disruptive. The fourth complication is migrainous infarction, a stroke that occurs during a migraine with aura. This is a rare but serious complication of migraines, and immediate medical attention is necessary. Lastly, we have migraine-triggered seizure, also known as migralepsy. This is a seizure that happens within an hour of a migraine aura. It's a rare condition, and the relationship between seizures and migraines is still being explored. These complications underline the importance of managing migraines. So, how can we prevent migraines? Preventing a migraine is better than treating one. So, what steps can we take to prevent migraines? Firstly, managing stress is paramount. Stress is a common migraine trigger, and finding healthy ways to cope with stress can help. Consider relaxation techniques like deep breathing, yoga, or meditation. Secondly, don't underestimate the power of regular physical exercise. It releases endorphins, the body's natural painkillers, and promotes better sleep, which can in turn reduce the frequency of migraines. Thirdly, a healthy diet is critical. Some migraines are triggered by certain foods or drinks. It's important to maintain a balanced diet and keep a food diary if you suspect certain items might be causing your migraines. Fourthly, never compromise on sleep. Sleep deprivation can induce migraines, while a regular sleep schedule can help keep them at bay. Aim for 7 to 9 hours of sleep each night. Lastly, steer clear of known triggers. These can vary greatly from person to person and can include anything from bright lights to changes in weather. Keeping a migraine diary can help identify these individual triggers. In essence, prevention involves a holistic approach, taking care of your body in multiple ways. It's about maintaining a balance in life, from managing stress and ensuring physical activity, to eating right and sleeping well, to understanding and avoiding your personal triggers. Prevention is a crucial part of managing migraines, but if a migraine does occur, how can it be treated? Migraines can be managed and treated effectively. What are the treatment options available? Let's dive into the 5 primary methods. First, we have pain-relieving medications. These are often over-the-counter drugs like ibuprofen or prescription medications like triptans. They're designed to stop the pain once it's started. Next, there are preventive medications. These are usually taken regularly, often daily, to reduce the severity or frequency of migraines. Examples include cardiovascular drugs, antidepressants, and anti-seizure drugs. Thirdly, lifestyle alterations can play a significant role in managing migraines. This could involve identifying and avoiding triggers, such as certain foods or stress, maintaining a healthy sleep schedule, and incorporating regular physical activity into your day. Our fourth option is relaxation techniques. These methods, like meditation, yoga, or biofeedback, can help reduce the frequency of migraines and lessen the pain when they do occur. Lastly, in some cases, medical procedures might be necessary. Botox injections are one example, which are often used when other treatments aren't effective. Another option is nerve stimulation, where a small electrical device is implanted to send signals to the brain to block pain. Remember, treatment options are varied and should be chosen based on individual needs and medical advice. It's vital to work with your healthcare provider to find the most effective treatment strategy for you. With the right approach, migraines can be more than manageable. They can be significantly reduced, allowing you to reclaim your life from the grip of this debilitating condition. Migraines can be a challenging condition to live with, but understanding it is the first step towards managing it. We've delved into the world of migraines, exploring their definition, identifying their symptoms, understanding their causes, and acknowledging the complications. We've also outlined the proactive steps for prevention and discussed the available treatments. These insights provide a well-rounded perspective to navigate the journey of managing migraines. Remember, knowledge is power. The more you understand about migraines, the better equipped you are to manage them. Stay healthy and take care.